Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, February 10th, 2021. And thank you for your patience with the delay. As I'm sure you understand, this is a very fluid situation, and we want to be able to give you the most thorough and up-to-date information as possible. This is an incredibly stressful time for all of us, but I need to thank Dr. Fitzgerald on behalf of all of Newfoundland and Labrador for continuing to work tirelessly to help us all stay safe. And to everyone in public health, all the essential workers, frontline healthcare professionals, teachers, educators, staff, students, parents, and families. You are resilient and you are valued. Please continue to listen and to trust the experts like Dr. Fitzgerald and her team. Be kind to each other. I know it's stressful. I know the next few days and maybe even weeks is going to be tough, but we will get through it. We've gotten through it before, and we will get through this. So with that, I'll hand it over to Dr. Fitzgerald for the update.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since our media briefing yesterday, we have 53 new confirmed cases of COVID-19 in our province. In addition, we have 32 presumptive positive cases. All cases are in the Eastern Health region, with the exception of one confirmed case who is a resident of Eastern Health but tested in Central Health. The breakdown of confirmed cases is as follows: 44 under the age of 20, 4 between 20 and 39, 4 between 40 and 49, and 1 between 50 and 59. The total number of cases in our province is 510. There have been no new recoveries since yesterday, leaving 110 active cases in the province. 860 people have been tested since yesterday, for a total of 84,220 individuals tested to date. Almost 8,000 of these tests were done in the last 2 weeks. We continue to see high case counts, and we should expect this to continue as contact tracing and testing continues. The positive cases we are seeing now are primarily the result of exposures in the last 2 to 3 weeks. We have over 1,000 people that have been or will be tested who are associated with Mount Pearl Senior High School. We have hundreds more actively being identified by public health as close contacts. I believe that going so long with low case counts of COVID led to complacency, and we are now seeing the repercussions. This was something we had worried about and cautioned against. Children and youth have been involved in extensive extracurricular and social activities, resulting in high numbers of close contacts and now widespread virus transmission. People with mild symptoms had not been seeking testing and have been unknowingly transmitting COVID-19. This is an important lesson for parents and communities, particularly for those outside the metro area who have a window of opportunity now to change their daily interactions and prevent a similar situation in their towns. Our focus now is on getting the spread of COVID under control. We are therefore amending special measures orders to reduce the risk province-wide. Effective immediately, all group and team sport and recreation activities where children, youth, and/or adults gather in person and where close contact is required are suspended across the province. Group arts and cultural activities that involve in-person gatherings where close contact is required are suspended. This and across the province, and this includes bands, choirs, dance, and music classes. We will reevaluate this in 2 weeks. Based on what we were seeing in terms of the volume of cases and spread, we are recommending that all K-12 schools in the metro area close. As well, we're recommending post-secondary institutions close in the metro area. We are increasing restrictions in the St. John's metro area effective midnight tonight. Formal gatherings such as funerals, burials, weddings, and religious and cultural ceremonies are limited to 10 people as long as physical distancing can be maintained. Wakes and visitations are prohibited. As indicated previously, informal gatherings must be limited to your household bubble. If you are a one-person household, you may join with another household bubble. Private healthcare clinics can remain open in accordance with provincial guidelines. Childcare services will remain open. We must maintain our frontline essential workforce, and therefore childcare facilities are necessary. We strongly recommend, however, if you are able to keep your child at home for the next 2 weeks, that you do so. Retail stores that do not provide services essential to life, health, or personal safety of individuals and animals are to close to in-person service, but can offer online telephone sales with delivery or curbside pickup. Personal service establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons, are to close. Animal daycares and grooming facilities can remain open provided that they can ensure contactless drop-off and pickup. Restaurants are closed for in-person dining. Takeout, delivery, and drive-through options are permitted. Bars, lounges, bingo halls, and cinemas are closed. Group and team sport and recreation activities are suspended. Group arts and cultural activities are suspended, including bands, choirs, dance, and music classes. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas, dance studios, and performance spaces are closed. Outdoor activities, including walking, hiking, or snowshoeing, are encouraged, as long as physical distancing can be maintained between household bubbles and you are not required to self-isolate for any reason. Outdoor playgrounds can remain open. We are also advising strongly against travel into and out of the metro area. Travel to and from this area should be for essential purposes only. If there is any good news in all of this, is that people are now listening to the public health advice and getting tested. That is critical to containing the outbreak. We are conducting widespread testing, and all contacts of high school students are being tested and self-isolating. For students and staff of Mount Pearl Senior High, you must self-isolate for 14 days from the last day you attended school or were in contact with a positive case, whichever is more recent. You must self-isolate for this entire period, regardless of whether you've had a negative test result. I know there is a great deal of fear and worry about the latest developments. I caution you not to channel your emotions towards the individuals who have tested positive for COVID. No one sets out to get or transmit COVID. I imagine how these people must feel. They do not need social stigma on top of what they're coping with. I'm particularly worried about this as there are many young people involved in this outbreak, and in the era of social media, rumors and accusations can be rampant and damaging. So before you post on social media, remember the acronym THINK. Is it true? Is it helpful? Is it inspiring? Is it necessary? Or is it kind? As a recap, for those who may have just joined us, we have 53 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 510. We are in for a rough period in the days and weeks ahead. Just as you have put your trust in me and our public health team, I have every confidence that the people of our province can overcome this. I believe you have the desire and the determination to do what needs to be done. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for some brief comments.
Thank you very much, Premier, and I will be brief. It's day 340. I want to start by thanking Public Health and Eastern Health in particular for their sterling work over the last few days. You will be stressed into the future, and the department and us stand ready to support you with resources that you might need. We have rapid testing kits aplenty, and we have ensured our supply chain is up to the task of any testing that might be required. I would echo Dr. Fitzgerald's concern. If you have any kind of symptoms or fall into any of the categories that have been mentioned in the advisories, get tested. A case reported is a case contained, and that is what our aim is at the moment, to try and put a lid back on COVID-19. Presence of any symptoms, if you have access to the internet, I would guide you initially to the COVID assessment tool online. That will speed the process up. It goes directly to the relevant RHA, who will then contact you rather than having the intermediate step of a phone call. Obviously, if you have difficulties with internet, 811 via phone stands ready to help. It is, as the Premier and Dr. Fitzgerald have said, a dynamic and changing situation. The information we release as government strives to be accurate, and so it can be trusted. So it may not reflect more than a simple point in time, and that is clear and has been made clear in the past. So I think speculation between times is not always helpful, and I would echo Dr. Fitzgerald's comment around posting stuff. It is a stressful period. Premier started out with that. Reach out to your virtual network of support, and if you find even that a challenge, then Bridge the Gap with 2ps.ca has plentiful resources both for children, for youth, and for adults. And I would encourage you to use those to help cope with some of the anxieties and stresses you feel, which are all entirely normal. You've got clear advice from Dr. Fitzgerald and some clear guidelines in the form of special measures orders. Please stick with those. You've done it before. We've got through it before. And so I would close, Premier, by simply saying what Dr. Fitzgerald said. We've done it before. Hold fast. We can do it again. Thank you.
Well, thank you, Minister Haggie. I'll now open it up to media for questions.
Thank you, Premier. For the benefit of our speakers, there are 10 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Hello, Dr. Fitzgerald. Has public health reached out to high schools at any point to ensure mask policies have been implemented and are being enforced?
To ensure what was being implemented and enforced? I'm sorry.
Mask policy.
Mask policy.
Not public health itself would not be responsible for enforcing mask policies. That was a policy that was brought in by the Department of Education. But public health is not, it's not our mandate to enforce, perform enforcement, I guess.
Okay. Thank you. And are people in isolation allowed to leave their homes? And if not, does an exemption have to be made for drive-through voting?
So people who are in isolation are allowed to be on their own property, but other than that are not permitted to leave their home. With regard to the voting, that's discussions that we're trying to determine how to do things safely. So those discussions are happening.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We've seen the lineup coming for a lot of the testing centers. I'm wondering if public health is looking to add any additional testing sites.
Minister, perhaps you can comment on that one.
Yes, certainly. Sorry, I had some technical issues with my phone connection. Yes is the short answer. Should they be needed and we see a significant demand or with a backlog for testing, more sites will be opened up as necessary.
We currently have 110 active cases in the province. You announced 53 confirmed today. Through the height of calls, we weren't seeing numbers like this. How much worse is this than the call situation last March?
So this will be, I expect that we will see significantly more cases from this than we did from calls. We are seeing a younger age group, so that's somewhat different. But yeah, we're going to see it's certainly public health, we are all anticipating seeing more cases than with the outbreak we had early on.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, Elections Newfoundland and Labrador has said they're essentially leaving it up to you about whether or not it's safe to vote. So in light of this increase in cases, do you still believe it is safe for voters to go and vote in person on Saturday? And what would have to change between now and then for that to change?
So those conversations are happening. We're certainly willing to work with the Chief Electoral Officer and his department to determine how things have to be done, what has to be done for this to happen safely.
So with the current levels, do you still think there is a way to do it safely?
We'll have to find a way, so yes.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. Are these cases that we have right now, are they being tested for variants?
So we are testing, we have some criteria that we use to test for variants, especially any that have come from, that are travel related or that have particular, if we're seeing a particular increased spread more so than we would expect to see, those sorts of things. Those are criteria that we have for sending testing off urgently for the variants. Many of our tests, certainly up until just recently, all of our tests were being sent away to be tested with whole genome sequencing. But as our case numbers obviously have risen, we are not able to send every test off now. So we are sending off a representative sample of our testing for sure for whole genome sequencing, and then any that meet our criteria of higher concern, we will be sending those as well.
Okay, all right. And then I'm so sorry if this is incorrect, but we were working on having our own capacity for testing for variants in the province. Is that correct?
Yes, it is.
Yes. How is that coming along?
It's going well. I've been told that by the middle of the month we should have something. So, barring any major equipment delays or anything like that. So, we anticipate that fairly soon we'll be able to do that.
Okay. Thank you so much.
Our next questions are from Brian Callahan with BOCM. Please go ahead.
Good afternoon. Just to be clear, we are still at alert level 2, and you've decided that it's not necessary to go to 3 or 4 at this point?
Well, so the alert level system was sort of for coming out of the last time. And so what we've put in now and what we've always said that we will put in are targeted measures. So I think, the measures are what they are. It's irrelevant really what number we put on them. We just have to do what we have to do right now. So, if you look at these measures, they're somewhere between 4 and 5, some are in 3, but we're doing what we feel we need to do. We've learned a lot since we were in those levels, and we've learned a lot about how this virus moves, and we know about how to protect ourselves. And so, we feel that you can't apply a system that we had back last year in April or May or June, to where we are right now and what we know. So we're making these decisions based on evidence and the best practice, and localizing them to where we need to put them. So, it's I don't think going back and calling it a number is really necessary at this point. We just have to do what we have to do.
Thank you. And Dr. Fitzgerald, you mentioned a moment ago that you have to make it work regarding the election. Why have to? Again, there are options, and I don't want to belabor the election point, but when you just said it has to happen, why can't it not happen right now?
So I'm not a scholar of the law regarding the election, but we will make the election happen in a safe way. We'll be working with the Chief Electoral Officer's staff and with himself to make sure that this can happen safely.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
Hello. First of all, I'd like to ask Dr. Fitzgerald if there are any hospitalizations either from this new group of, by my math, 5 cases or overall.
No, at the moment we have no hospitalizations as a result of COVID-19.
Okay. Second question is for Mr. Fury. What, if any, consideration have you given or did you give to changing the election law and moving the election back as far as next year, as reportedly former Premier Paul Davis did back in 2015?
Look, we made the election call with the best evidence available to us at the time. I don't believe altering legislation for political gain is an important instrument of democracy.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Another day, and more people have tested positive. So I'm wondering, do you, Dr. Fitzgerald, do you have an approximate number of how many people are currently self-isolating in the province?
It's upwards 1,500. I couldn't tell you exactly.
Thank you. And I'm wondering how many people who are tested positive or are currently in self-isolating are working in some capacity in relation to the healthcare system?
Oh, I don't have that information, sorry.
Okay, just to follow up sorry.
No, I was just going to say that information isn't immediately available, Elizabeth. I'll be happy to talk to departmental staff and see if we can find it for you.
Thank you. I'm just asking because it was announced earlier this morning that Unit 6 East at St. Clair's Mercy Hospital did have a positive case.
Sure, I hear you. I don't know what the numbers are. I'm only aware of maybe 2 or 3, but I would have to go and check.
All right, thanks.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Dr. Fitzgerald, on Monday, I think it was Brian Callahan who asked the question, does the final decision to postpone or cancel the election lay with public health officials or with Mr. Chalk? The Premier answered that question saying it was Mr. Chalk. Just to be clear, is that also your view?
Yeah, the law is the law. I don't have jurisdiction over the election. It's not a view.
To follow up, Section 28 of the Protection and Promotion of Public Health Act gives you the power to do specific things like you've just done, closing schools and restricting travel. And my question is this. Subsection K of that act of Section 28 gives you the power to, quote, take any other measures you reasonably believe is necessary for the protection of the health and population during a public health emergency. As I read the act, it seems like you have sweeping discretionary power to take any measure you think is necessary. And it doesn't say with the exception of postponing or canceling the election. So am I missing something here?
So I'm, again, not a legal scholar. And there are lots of different legislations which would come into play here, and how one overrules another is certainly not my area of expertise. But my power does not extend into this.
Thank you.
Our next questions are from Drew Brown with The Independent. Please go ahead.
Hi. I was wondering if we have any information on the positivity rates on the tests that are being done currently.
Our positivity rate right now, I think, is hovering somewhere close to 4 or 5%. I will have to get that number confirmed for you, though, if you want to follow up after.
Perfect. Thank you. So my other question is that despite a bunch of assurances to the contrary, we've heard that there are a lot of important processes and decisions and committees and stuff in government and healthcare that have sort of ground to a halt because of the caretaker convention in the election. Do these concerns have any merit, and how would you respond to that?
Perhaps I should deal with that one as it's around healthcare particularly. There is a convention that civil service staff can make routine decisions to keep the the department ticking over. The regional health authorities have full operational control over healthcare operations, but matters around policy and significant expenditures are suspended during a caretaker convention, with the exception of those that may be necessary to preserve public safety. So it's a kind of qualified answer, but routine healthcare, planned and emergency, is still continuing unaffected by the caretaker convention.
Perfect, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. I'm just looking for a bit of clarity. The Commissioner of Elections talked about his plan for drive-through voting. Dr. Fitzgerald, you said that people are not allowed to leave their houses if they're in isolation. Does that mean that the Elections Commissioner's plan for making people able to vote doesn't work?
So, as I said, we're working with the Commissioner's office to find a safe way for people to be able to exercise their democratic right to vote. So, we'll certainly be continuing to do that between now and Saturday.
Okay, so just to be clear, the plan that Mr. Shaw talked about today, there's changes earlier today. Changes need to be made to that plan.
So I'm not saying that. I haven't seen his outline plan at this point. So I think that it would be premature for me to say anything in this venue.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, Dr. Fitzgerald. I feel like I'm picking on you. The poll workers have been told, and we have at least one eyewitness of it, that they can either wear a mask or a face shield. Do you think that's wise advice given the circumstances?
I'm sorry, who's being told that?
Poll workers.
Poll workers. No, so
yes,
our recommendation would be that all people should be wearing a mask, and then a face shield will help protect the eyes. So, but all people should be wearing a mask.
Okay, thank you. And also, there's a case of a poll worker who tested positive during a training session. I'm wondering if the public will be notified if that poll worker worked at any polling station during advanced voting.
So contact tracing will be carried out, and if it is felt that there's any risk, then the close contacts will be notified. As per our routine contact tracing and notification protocol.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Teachers have been advised that they still need to go into their workplaces to conduct the online learning. Many of them are parents with children that will now have to remain home. So what are they supposed to do in this situation? Why can't they conduct their online learning from home?
Well, this is an evolving situation that I'm sure the Department of Education and the school district will help sort out.
Okay, so what are you suggesting that these parents do while they have to go into work?
Well, currently, they'll have to abide by the rules. But again, this is an evolving situation that just occurred. The decision was just made. So I'm sure there'll be flexibility. And again, we'll have to talk to the Department of Education and the school district to work through that.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, can you give us the number? How many students and staff at schools have tested positive? And we know about Mount Pearl Senior High, but what other schools have we seen positive cases from?
So I'm not aware of all of the cases and where they are located at this point in time. That investigation is evolving and evolving very quickly, unfortunately. We may be able to get that information for you, Peter, but I don't want to misspeak publicly.
And we've seen quite a few, we've got the confirmed positive cases, but we're seeing quite a few presumptive cases. Can you explain how those fit in that category and what you're waiting for in order to make them confirmed, or I guess not?
So presumptive cases are those which are done with our rapid testing kits. So we're using a rapid antigen testing kit that will tell us fairly quickly if somebody is positive or negative. It is not meant to be used for diagnostic. It's a screening tool, and therefore we have to get a confirmatory test with that. So we do treat all presumptive positives as a positive, and so we do, make the same recommendations about isolation, but we don't confirm them until they've been tested at the lab with the PCR tests that we traditionally have used.
Thanks.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. Is this still a scenario of 3 clusters?
At this time, no, it probably is not. There is probably more widespread transmission than that.
Okay. And then I wanted to ask, we know that the resumption of Pfizer deliveries is supposed to resume to its regular schedule next week. Have we made any changes to our vaccination practices or plans?
No, so our goal at this point is obviously our priority groups for phase 1, so we're still working through those. Right now, we certainly do have priorities for congregate living facilities for seniors, and especially with this increased transmission now, it's even more important to get there. So that's where our focus is going to be in the coming days.
Okay, thank you so much.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. We know that students of a certain age, and if you could clarify the age at which teenagers or students can be vaccinated, I believe it's 18 and over or 18 and under, cannot be. Has consideration been given to bumping teachers up the line as far as a priority for vaccines?
At this point, because of the amount of vaccine that we're getting, which is still not a lot, even though we're getting back on track, our priority has to be in those groups that have the greatest risk of severe COVID-19 disease and death. And therefore, our focus is still where it was at the beginning of phase 1, which is in congregate living facilities for seniors, for people who are working frontline, and our Indigenous communities and our people. Right now we're starting, our goal in phase 1 is people over the age of 85. Some areas may be able to or will slowly start to reduce the age as we get more vaccine in, but those are our priorities at the moment.
Sorry, and I don't think this will count as a follow-up. I did mention there just clarity around how young is too young to be vaccinated.
So right now we're saying 18, and the evidence on that as to how effective these vaccines are in children, that's still the studies are still ongoing.
Okay, thanks. And my follow-up, the virus we know, and you've told us many, many times, the virus can only move, and the risk increases when people move. And it's clear there will be a lot of people moving on Saturday during the election. So how do you feel about that?
So we can move safely, and that's what we have to ensure can happen. And we're working to do that. So I think we all have it in our power to make that happen.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
For Mr. Fury, we know that it was your idea to hold the election. You're quite keen on converting the party mandate into a mandate from voters there, and to convert the minority into a majority at this time. You have said repeatedly it's not your decision about whether the election goes forward, but how important is it to you that it go forward?
Well, look, I mean, my primary focus right now is on supporting Dr. Fitzgerald and her team. I know this is stressful times, and the decision to call the election was made when we were in very low numbers, and we make the decisions that with the evidence that's available to us at the time. I think that Dr. Fitzgerald and Mr. Chalk will work to provide a safe polling period for people. You can't forget, polls are individual. They're not group activities. So I think it can be a safe an election moving forward.
And my follow-up is, how difficult is it to separate your political ambition at this time?
Well, look, it's, my previous life, I'm not a career politician. Ambition is one thing, but primary focus is on public health and safety. I've got family at home. I've got kids at home who are now not going to be able to go to school. I have parents in their 70s. I'm an individual like everybody else out there. I feel the stress and strain that exists. And my primary focus is on COVID-19 right now, and ambitions are set aside.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. I'm wondering, how long can someone now expect to wait in order to get tested?
John? Minister?
Yes, sorry, Premier. I'm struggling with the technology today, unusually. The testing is arranged on the basis of risk stratification. So those people who are contacts of contact, or for whom, for example, the Biggs restaurant was backward tracing, they are prioritized lower down. And we're monitoring the waiting. It's usually within 24 hours that people get a test. And for people in Metro, it's a very short run to the public health lab, and the turnaround time there is of the order of just over 8 hours currently. So we're keeping an eye on those times, and if they start to creep up, as referenced in an earlier question, we'd look at whether we need longer testing, longer opening hours for the testing facility, or even more testing sites. So we're keeping an eye on that.
Thank you. And Premier, with Nova Scotia tightening its borders with Newfoundland and Labrador, what is the current future of the Atlantic bubble?
Oh, well, we haven't really thought about the bubble that much right now. Our primary focus is on containing and controlling this current outbreak. We'll revisit the Atlantic bubble once we can get the metro region under control.
Thank you.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Premier Fury, yesterday you were asked if appearing at these briefings during the election gives you some kind of an unfair advantage. I want to ask you if you think it puts you at a disadvantage. You've said you took the same risk taken by other premiers in BC and Saskatchewan and New Brunswick. It worked out for them, but every day you're sitting here this week raises questions for voters that maybe your judgment isn't as good. So do you think being here at these briefings is an advantageous place to be during the home stretch in this election?
Look, as I said before, I don't see it as an advantage or a disadvantage. The people of the province need a premier right now, even if it is a caretaker premier, and that's the role I'm fulfilling. In terms of decision making, you make the decisions with the evidence available to you at the time. The other jurisdictions across the country had a higher burden of COVID-19 when they called the election than we did. They had different epidemiology than we did. But one thing we've all known is that there's nothing completely predictable about COVID-19.
And Dr. Fitzgerald, a COVID-specific question. About a week and a half ago, there was a cluster that couldn't be traced. There was an individual, and then there was somebody from that person's household. And then the next day, there were 2 other people, and there was somebody connected to a daycare. Has the tracing of this current cluster tracked back to those 5 people, or have you ruled that out?
So at this point, no, we have not made any connections there. So never rule it out, but we haven't been able to make those connections at this time, no.
Thank you very much.
Our next questions are from Drew Brown with The Independent. Please go ahead.
Hi. So I was wondering, we've heard that the decision to call the election was taken after some discussions about when would be the safest time. My question is was public health asked about that, like what would be the safest time specifically, and is there any sort of documentation that could be provided from their opinion?
Well, we had evidence of a safe by-election. There was public health guidelines announced in October with respect to elections, and after that. So, I mean, it was in, consultation. No one has a crystal ball. We all wish we did, but we don't. And at the time, the cases were low, and we had come out of Christmas and New Year's without any significant peaks, and so the decision was made at the time that this was the safest period.
Thank you. The other question, I'm just wondering, do you think there would be any sort of benefit to maybe bringing Bruce Chalk onto one of these panels so he can sort of speak to a lot of these election COVID hybrid questions, the same way that we've seen past experts brought on to panels to sort of clarify the situation?
Yeah, sure. My understanding was Mr. Chalk was doing individual media avails as opposed to a group avail, so I'm sure he'd be more than willing to chat with each and every one of you.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, Dr. Fitzgerald. I'd like to just come back to comments you made on the voting plan from Elections NL. You said you hadn't seen the plan. Does that mean that the plan with drive-through voting that was announced earlier today had not been pre-approved? There hadn't been consultation with public health before that was announced?
So it just means I haven't seen it. I don't know when the plan was it wasn't my plan to develop, so I really can't answer that question.
When we're looking at these cases, is there a location or event that's the biggest source of spread that can be identified at this moment?
No, not at this time.
Thank you, everyone. I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram. Do you have a final question?
Yes, one quick question for the Premier. The school board has an exemption policy in place for virtual learning for children who have specific medical issues, but there is no actual overall plan for virtual learning on a large scale. Is there any negotiation or talks going on with the Department of Education as to how this will be handled, if that in fact becomes necessity?
Sure. I mean, again, each school has their own plan to transition to virtual learning. It's something that was thought about by the school districts. And I know there's individual circumstances in different cases, and I'm sure the department would be happy to work through those with families to ensure that every child has the educational opportunities during this tough time.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, many, but I'll go with one. Looking to know if there's an indication on how many people have been alerted by the COVID app to be tested and how crucial that app is right now with all the public health resources kind of being strained.
Kellyanne, I could take that. There are 15 keys that have been issued by in response to the COVID app, and only 12 of those have been used. What I can say is that in a tech-savvy group such as we're seeing, this app would have been a godsend.
Thank you.
Peter Cowan with CBC. Do you have a final question?
I do. Dr. Fitzgerald, I'm wondering if you can give us a little bit of insight on the epidemiology here. I know this is still rapidly progressing and you're still learning about it, but can you give us an idea of how this virus was able to spread? Is this within the school environment, households, workplaces? What are you seeing from these new cases?
So we're seeing a lot of cases that have resulted. What we're seeing as a result really is we're seeing some school transmission. We're also seeing transmission through sports teams. A lot of contacts with sports teams, a lot of children on separate, different sports teams. So, it's spreading that way. That's why we're seeing it in other, we're seeing contacts in other schools. Really it's through social activities, sports activities that we're seeing that spread, and then we're seeing spread in the household units as well. But there are also other groups that are completely separate from the school, right? Like that are completely testing positive with no identifiable connection to the school at this time. So there's certainly community transmission happening throughout the metro area.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yes, I just wanted to ask Dr. Fitzgerald, how are you feeling today?
Yeah, you know, I mean, it is what it is. This is what COVID does. It's a bit disappointing to see the number of contacts that people have had. I think we really need to do better when it comes to reducing those contacts, and I think people across the island need to take a lesson here and to really start thinking about how they're going to reduce those contacts. It's, you know, we've had our few practice runs in Deer Lake and Harbour Breton and Grand Bank, and now here we are with the big one. So we really need to start taking this seriously.
Thank you.
Brian Callahan with VOCM. Do you have a final question?
Yes, thank you. Premier, you've mentioned many, many times that the numbers were low when you called the election, but with respect, isn't that irrelevant at this point? I mean, now is what matters, and now there's an outbreak, and now there's community spread, there's schools are closing, businesses are closing, it's in a hospital at this point. So is Andrew Furey, the doctor, completely comfortable with the decisions being made by Andrew Furey, the politician?
Well, you know, you can't split the two, of course. You know, you make decisions with evidence that's available to you. You know, I wish I had a crystal ball, but nobody does. We had come through the Christmas season, which, you know, you all heard us on this panel talk about it being a high-risk season with low numbers. I mean, you can't predict the future with 100% certainty, and you know, I have confidence that Dr. Fitzgerald and Mr. Chalk will navigate us safely through this election.
Thank you.
Ross Lord with Global News. Do you have a final question? Okay. Ross must have hung up. Elizabeth Whitten with All Newfoundland Labrador. Do you have a final question?
Yes, I'm looking for clarification on the measures. Dr. Fitzgerald, do you mean to say they'll be revisited again in 2 weeks' time, like restaurants being closed to in-person dining?
Yeah, so we'll be revisiting in 2 weeks from today, yeah.
Perfect, thank you.
Roger Bill with iPolitics. Do you have a final question?
Yes, I do, for Dr. Fitzgerald. Dr. Fitzgerald, you call this the big one, and you said we're in for a rough period. I'm like most people, kind of shocked by the fact we find ourselves in this situation now. We've gone from 11 positive tests to 30 positive tests to perhaps 50 to 80 positive tests. Could we be at 150 tomorrow? Is that what the rough period could be? Could it be at 300 tomorrow?
Certainly not going to make any predictions about tomorrow, but, you know, I don't expect that tomorrow will be lower than today.
Drew Brown with The Independent. Do you have a final question?
Yeah, so I just want a little bit of clarification. So we've heard earlier in this briefing that some of the restrictions that have been brought in would sort of put us in the metro area anyway in various sort of alert level stages between 3 to 4 to 5, depending. I'm just a bit curious. So when we spoke with Bruce Chalk the other day, he sort of suggested that they would consider sort of postponing the election if things got to the level, like an alert level 3 or more situation. So I'm just wondering if it will, in the next few days, if we are expecting a rougher patch, if public health will push for a postponement of the election in the metro region, just sort of based on the measures that are in place.
So at this point, what I've said is that we will work to try to have as safe an election as possible, and that's where we are. We're going to work with Mr. Chalk to do that.
Patrick Butler with Radio Canada. Do you have a final question?
Yeah, I understand that it's the election commissioner's call in terms of any sort of different measures that are taken. The final call is his, but Dr. Fitzgerald, in terms of having a safe vote with some sort of alternative measures for people who are in isolation, when do you think we should have a plan in place to be able to do that?
So it's not my plan to put in place, guys. We consult on it. You have to direct those questions to Mr. Chalk.
Thank you, everyone. Premier, do you have any final comments today?
Well, thanks everybody for joining. I know these are stressful times. They are for everyone on this panel as well. But again, I'd like to thank Dr. Fitzgerald and her team for all their hard work. We will get through this together, as stressful and as anxiety-provoking as it is right now. We will get through this as long as we continue to follow public health guidance and advice. Wear a mask, keep your social distance, wash your hands frequently, and please use the COVID-19 app. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we